Have you ever been told that you have a tumor in your parotid gland and immediately thought, what is the parotid gland? You're not alone. In fact, most people have never heard of it until they are sitting in a surgeon's office discussing imaging, biopsies, or surgery. Today I'm going to explain what it is, why it's so important, and why surgeons take such an incredible care when operating in this area. The parotid gland actually is one of the largest of your salivary glands. If you place your fingers just in front of your ear along your jawline, you are touching that area where it sits. Its primary job is very simple. It makes a watery, enzyme-rich saliva. The saliva helps to lubricate your mouth, begin digestion, protect your teeth, and makes chewing and swallowing much easier. The saliva then travels through a tiny tube called the Stenson duct, eventually emptying into your mouth near your upper molars. It's something your body does automatically thousands of times every day without you ever thinking about it. Here's where things are getting really interesting. Running directly into the middle of the parotid gland is one of the most important nerves in the body, the facial nerve. Think of it as the trunk of a tree. The branches are going into 5 major limbs. Those branches control smiling, closing your eyes, raising your eyebrow, puffing your cheeks, moving your lips, and many of our facial expressions. When surgeons remove these tumors from the parotid gland, they aren't just removing tissue. They are carefully working around this incredibly delicate network of nerves. That is why parotid surgeries require meticulous planning and extraordinary precision. So what happens after surgery? Many patients experience temporary weakness after surgery. You might notice difficulty with smiling, trouble with closing one of your eyes completely, weakness in your lip, and difficulty holding liquids in your mouth. You can also notice numbness surrounding the ear, swelling, and tightness in the jaw or the neck. For many people, these symptoms improve with healing, but rehabilitation can play an important role in maximizing recovery. As speech-language pathologists and rehabilitation specialists, we often work on facial movements and exercises, jaw mobility, swallowing, lymphatic or lymphedema management, scar mobility, neck range of motion, and functional recovery. Every patient's recovery looks different, which is why individualized care is so important. Understanding this anatomy helps you to understand your treatment. The parotid gland may be small, but the surrounding structures are incredibly important for facial movement, speech, swallowing, and quality of life. If you're preparing for parotid surgery or you're recovering from treatment, know that rehabilitation is often an important part of that journey. Here at Head and Neck Rehab, our mission is to help patients understand what's happening to their bodies and to give them the tools to recover with confidence. If you're a patient who's had a parotidectomy, let us know in the comments. What surprised you most about your recovery? If you're looking for more tools and resources, download our HNC Lymph SLP app below and follow along for handouts, models, and visuals to better understand your body. I'm Lauren Meffin, speech pathologist and certified lymphedema therapist. Thank you for allowing us to be a part of your journey.